Which side do I hold this thing on and why is it important? Learn what to do, how to set it up, and how you can be more stable using this important device. But first, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. We appreciate your support. So let's get to setting up this contraption. So which side does this cane go? Some shows out there have shown it incorrectly, like Dr. House on House MD. What we teach is that the cane should be held on the opposite side of the strong leg to give you a better base. It would essentially give us a chance to offload the weaker or injured leg. When it comes to walking and ambulating, we will demonstrate with the right leg as the injured leg. You are more than likely to use a cane because you can bear some weight or need to offload. You have the option to do a 3-point gait or a 2-point gait strategy. In a 2-point gait, the leg and the opposite leg are fixated or tied together like one leg, where the cane lands in the same plane as the toes or your metatarsal break. Believe it or not, I think this is the most stable. The 3-point gait with the cane is where you stick the cane out first and then step to it with the strong leg and then the injured leg. Let's get to the stairs. I know we don't get out of the office much, but you may have noticed we're not in the treatment room today. If this staircase looks familiar to you, it's because we have most definitely shot another video here before. You might recognize it from our how to walk up and down stairs videos. If you want to go back and recap those to see our foundation of walking up and down stairs, before you see how it changes for this cane video, you can find the link in the descriptions below. When encountering stairs, remember the phrase, up with the good and down with the bad. Good people go to heaven and bad people go to hell. When going up, you always need a stable base. If you have access to a rail, use the rail and move the cane to the opposite side or don't use it at all. You leave the cane on the lower step and push the good leg forward and up. When coming down, if you have the rail, use that and move the cane to the free arm. Use the cane in front as a braking mechanism and come down cautiously. In instances where there's no rail, you could stick the cane down first or go sideways and down with the bad. Please give this strategy a try and see if it helps. Let us know what you think and leave us some feedback in the comments box below. Once again, please like, subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.